I think COVID has presented some massive challenges to the epilepsy and the neurology community. When I mentioned earlier on that it's really important when things are not going well that you have to dig deep and find out again, consider the classification, consider the diagnosis, consider the lifestyle impact of your patients. Having to do that remotely by telephone makes it so much more difficult. And sometimes patients can not deliberately hide, but can have concealed from them the importance of making significant changes to their lifestyle to improve epilepsy. And if you're not seeing someone face to face, it can make it really difficult to connect with them on that human level and allow yourself to access the parts of their life that are actually injurious to their health. There will be improvements, and there is no doubt there are some patients and some families who are not having to come up to the clinic and being able to access, usually telephone, to a lesser extent video consultations has been a big improvement in that ability to quickly connect with families, and the requirement of the NHS here in the UK to pivot quickly into remote learning will be useful, and hopefully we can take the best from this but return to allow us to the high quality interventions that are required when immediate response to treatment is not available.